It is great to see you all and those in Zoom land. That is unfortunately a sign of where we are again. No, I am not the virus, but the virus is me and is continuing to wreak havoc with our lives. So I'm going to try in 5 minutes. I will try. I know I will. Within 5 minutes, try to give you COVID 101, or at least where we are right at this moment in time. Because to talk about this virus and this disease and this pandemic, of course, I could do so for hours. But thankfully for all of you, we're going to keep it to just where we are right at this moment in time. So obviously, as I said, that by virtue of us having our masks on, people being in Zoom, we're not in a good place. And I, among all of you, am most unhappy to report that. It has come about for a number of reasons, not completely unexpected, but really the Delta virus has what has wreaked havoc with the direction that we thought we were going. So just to give you some numbers, we, in the first 2 weeks of August, surpassed the entirety of the month of June in terms of our cases, over 1,500 to be exact. In the first 3 weeks of August, I can make a comparison of 2,436 cases compared to 163 cases in the entire month of June. Likewise, we saw this week 162 cases in a single day. So it puts you in perspective. We haven't seen numbers like this, of course, since January, February. And what's most distressing is that the rate of increase in this surge is worse than what we saw in the winter. And that's consistent with what we know about this virus and how quickly it takes hold in finding its next person. 55 people in the hospital yesterday, 16 of them in ICU, again, numbers we haven't seen since February. And what's really worrisome is that our pediatrics hospitals around the state, not so much here yet, but are full. This is not just happening in Mississippi, it's happening in California, where many of our hospitals are now on diversion, and including our precious resource of pediatrics beds are being put in strain. So in a word, it really is about this new virus, Delta, and the fact that that came along right at the time that we started to gather in great numbers. We started to move across the country. We all took off our masks. We started hugging each other. And so, you know, we will get through this curve. I know that I've said this many times before, but we will move through this one as well. For those of you who are vaccinated, which I suspect is many of you, do not despair. It is still a very protective vaccine, even against Delta. The protection is not just against getting the disease, which is 70-fold more likely if you have not been vaccinated, but even more importantly, it will, for the most part, with some exceptions, keep you out of the hospital and keep you from dying. So there's no better medicine that I can offer, and through time immemorial, vaccines have been our ticket out of pandemics or endemics. So you know, lots of people like me and lots of medical people have been very tepid about this virus, about this vaccine. I will give you a full-throated 100% support, as I've been doing even before it became fully approved this week, the Pfizer vaccine, and that will come shortly for Moderna and J&J as well. So if you haven't yet had your chance to get your vaccine, if it's because of time constraints, it's because of uncertainty, everyone's available to talk to you at the Public Health Department about considerations, but I really, in no uncertain terms, urge everyone to go there. So in the meantime, what we're doing is, unfortunately, reverting to other means of protection, masks. And I've gotten a lot of input from people about why are you not doing a mask mandate when everyone else around you has. And this is SLO County. We don't have great enforcement. I can only recommend. I cannot come to your house. I cannot come to your place of business and put a mask on you. So I need to rely on all of you as businesses, as people in the community, to reset the social norm, to make it more culturally appropriate for the time being during this surge, absent higher rates of vaccination, that we go back to mask wearing. This is in lieu of some of the more aggressive protection measures, like shutting down businesses, keeping our schools closed. I never want to go back there. We're taking it step at a time. I've made it a voluntary request of everybody to resume indoor mask wearing. If I need to go further, I will. I'm not particularly optimistic that it would make that much of a difference, whether we're talking your health officer is here to give you a strong recommendation versus a mandate. We don't see compliance in some areas, and that would undoubtedly continue. But I'm here to say that this is what we need to be doing right now, is going back to, unfortunately, wearing masks indoors. They are safe, they are protective. There's lots and lots of literature on that if anyone wants to know. So in conclusion, just to say, I understand that this moment in time, again, especially now, is exhausting, it's frustrating, it's scary. It's been a tremendously difficult year and a half for all of you, as well as for my team. But the virus doesn't care about political affiliations. It's just looking for its next host, and it will continue to find it until we get to a place where we have really nearly universal protection through vaccine. We've done this before as human society. We've gotten past pandemics. Smallpox has been eradicated. Polio is this close to being eradicated. For those of you who don't know, I worked in India for a few months on polio eradication, and India is polio free, has been for the last few years. The only place on the planet now that has polio is at the Afghan-Pakistan border. So we as humans can get through these kinds of things. We will do so. This is our generation smallpox. Polio, it is not political. This is what we need to do. I ask everyone to come together, regardless of your perspective, and not turn on each other, but turn on the virus collectively, and to please do your part to get vaccinated. Lots of opportunities to do that through myturnca.gov or call 833-422-4255 to make your appointment. Don't delay. Join the 358,000 doses that have been administered in the US, 4.78 billion across the planet. It is a safe and effective vaccine, and thank you for listening.